Here's a way to manually stretch out the quadratus lumborum. If your patient is side bent towards you when they're lying on their side, that's going to add a bunch of slack onto the QL. So in order to combat that, I'm just going to take a towel, and you can fold it or roll it up, and I'll put that underneath their side in order to counter side bend them, or essentially put them in a neutral position. Definitely a lot more applicable on female patients. I'm going to use a pillow between the patient and I because I'm going to get really, really close to them. Now the QL is running in this direction because it attaches from the 12th rib and every transverse process down onto the iliac crest. So if the QL is right here, what we're going to do is try to essentially create like a bowstringing effect in order to internally stretch out the QL. This can work really well, and patients typically like this a lot. What I'm going to do is get the ulnar border of my hand right on the QL. You want to make sure that you are essentially just anterior to their paraspinal. So you can feel the QL in here, and if it is a problem, it typically is tender on the patient. You're going to find that QL, get the ulnar border of your hand onto it. When I do this, I'll do a little bit of a skin drag up, and then I'll get onto the QL, just so it doesn't feel like I'm ripping my patient's skin as I'm doing this. So drag that skin upward, latch onto the QL. You have a couple of options here. One, I can just hold on to my opposite hand. So I'll kind of do like almost like you're interlocking your fingers just to get some more pressure into it. Or good mentor of mine taught me to slide my thumb, essentially this web space, down my radius, grab on to the thumb, and I'm essentially creating an ulnar deviation with my right hand, which will create a radial deviation of my left hand. I can really get in there this way in order to stretch out internally that QL. Should just feel like a lot of pressure for the patient, but patients often really, really like this. I will either do this one, or I'll do this one if I really want to get some good pressure into this, because I feel like I can apply a lot more pressure into my hand by making essentially like a fist with both hands. And I'm just applying this ulnar border of my hand right into the QL. If you guys have any questions to how to do this, let me know.